It's the C word. You should never say cancer to a patient. Sorry. It's just your constitution. It doesn't mean you have.
Yeah, I know.
Do you know what I'm saying? Yeah.
Yeah.
But I don't know that you will get anything. It just seems like if I treat what the ancestors gave you. Yeah. Oh, thank you. All right. So, welcome human. If I come, it's very problematic in Chinese ideology. If I come to the world a certain way, I am the result of my ancestors. Okay, I'm a continuation of my ancestors. There's no way to undo that. Okay, there's no other way. I cannot come into the world. I cannot exist without having had ancestors. Okay, that's true about everyone and everything. You know, like this camera doesn't exist without its ancestors, whoever the hell they are. Okay, it could be the plastic that was. Everything comes from many things that contribute to it. On the other hand, the formation, which is the same character as wuxing, formation, xing, something that's being formed, I have to become me in my life. Welcome human, welcome the person that I am, is stomach 9. Now you can say, oh, it's because it's thyroid. By the way, she has period problems also. She has a whole bunch in puberty. It says, welcome human. Human is an adult, not a child. Okay? This character here is an adult. You know, this is a child. There's a difference. It doesn't say welcome child, welcome baby. It says welcome human being as an adult. Oh, are you sure you're okay?
Yeah.
So one thing we say, okay, reflection of thyroid. Thyroid has to do with puberty, has to do with glands. Okay, this is all very nice. Also, this area reflects what we call primitive reflex. Okay, it's a reflex of primitive reflex. Primitive reflex means something like throwing up type thing. Hiatal hernia could be a primitive reflex situation. Okay, so when I press stomach, I know it's not comfortable, I'm sorry. Hernia is much better.
Yeah.
Okay, now, how is...
It's still present, but...
Okay, we have liver 9, it's okay. How is adrenal, poor adrenal?
It's still 10% present. But
10%. Okay, 10% is not bad. Or as Kiiko says, leave it at 10%. Then they have to come back next week because they're ambitious. They have to pay again. Okay. Now, you said something uncomfortable in the hip here. Yeah? Mm-hmm. Yes?
Well, it's gone.
Wait. I want to...
Yeah, it's still...
This one?
Yeah.
Okay. When I press stomach 9, how is this one?
3% present.
3%, okay.
Just like a muffled kind of thing.
Okay, that's fine. Okay. Anything below 5-10, I mean, we don't have, it's gone. Okay. So we have to make her welcome the person that she is. Okay? We have to somehow tap into the ancestors through the Huang points, which I can't really do on the front, but I can do liver 9. Okay? Then I can do stomach 9. Then let's see, maybe I'll add adrenal. On the back, I have a lot more access to a lot more Huang. Okay? Are you?
Yeah, I'm fine.
You good?
Yeah.
Okay. By the way, any pain here? Because you broke this.
Slight there.
Slight? Okay.
Yeah, it's gone.
Gone. So for her, stomach 9 is super important. Now, let's take some insurance.
Yeah, fine.
Stomach 9 is not comfortable, right?
Mm.
Okay. When I press kidney 7, how is stomach 9?
So.
It's better. Okay. If stomach 9 is better, is hernia... No, hernia is not... Hernia really wants stomach 9. It's refusing. Okay. No. But wait. How about kidney 6?
It's better than before, but it's still there.
Okay, hold on. There's always more interesting thing. Kidney 7 to the center is called kidney 8.
It's better. It's only 30% left or 40, but stomach 8 is still better.
No, I get it, but I'm looking for
Yeah.
which
But
kidney,
is-
okay. And kidney 9.
There's 40% left.
So 8 was best. Okay. So again, I'm sorry. I know everybody hates it when I do this, but I can only teach you what my understanding is. I can't teach you another way. I'm looking for kidney channel and the throat relate. Okay. So in a sense, you're correct. I just didn't want to start with kidney. Now I'm looking which kidney point, and my thinking is this. If I'm going to welcome human, okay, I need to, well, actually, I can try and give it, let's see if I can give it to you in a way that's going to involve less point names. Yin. Kidney 8 is the Shi point of which channel? Yin Wei or Yin Chao or somebody?
Yin Wei.
Of Yin Wei? But Yin Wei starts as kidney 9, can't be. No, kidney 8 must have to do with Yin Chao. Sorry, sometimes I don't remember these things either. It's Yin Chao because it starts with Chao, Hai, Ta, Ta, Ta. Yes, yeah, because Yin Wei doesn't go through stomach 9, it goes to, it's Yin Chao. Okay. The name, so you can think Yin Chao to Yin Chao. Yes, thank you. More blankets. Is that better? Let's start needling, we'll talk later. I think we'll be happier that way.
So are you doing the kidneys because, well, for one thing,
To release stomach 9 first.
but also because of the adrenals, or just
And yes, and the adrenals. But you know, she broke a collarbone, so I won't be able to finish the adrenal anyway. Sorry, just for 1 second. Sorry. No, it's okay. You don't. How are we doing?
Yeah, it's 30%.
30. Okay, good. So, kidney 8. So actually, where I came from is not Yin Chao to Yin Chao. I came really philosophically. I said to myself, if she has to welcome herself as a human being, okay, she has to have trust in the process of life. This is called Xiaojin, trust intersection. To intersect trust, and I'll talk to you a little bit about it, how it relates to Yin Chao.
kidney 8 is called trust intersection.
Yes, the crossing of trust.
Not even cold, just
Yeah. I think it's, you know, sometimes, you know, we hear things, it makes the body unhappy.
every time I am still for a longer period, it starts shaking.
Oh. So kind of like restless leg, but with the body. Interesting. We're gonna take her out in a second if somebody wants to take her.
Aching here. Just stop aching.
Because she's got the hiatal hernia from her. Hold on. Do you need to move? Well, she's been left for a long time, so you sure? Okay, because I'm happy to take the needles out. Okay. Just rechecking. So kidney 8, liver 8, liver 9. I mean. Okay, we're good here.
It's still present. This one is almost completely gone. It's
Okay,
under 10%.
and the adrenal one?
was 20-ish.
20-ish. Okay, hold on.
You've done liver 9 as well.
Yes, I have. But I should have checked against the it's just when they start shivering, I kind of like try and get it over with fast. So, okay. How's stomach 9 now? It's okay?
Yeah, it's so sensitive.
Okay. And how's the adrenal?
Good.
Okay, and how's this guy?
It's under 10, so it's good.
Okay, under 10, so it's good. Okay, so stomach 9. And I know some of you don't like needling stomach 9. I basically needle it in front of the SCM, which is where it is, into the SCM and downwards. And the needle may end up looking differently, but that's kind of what I'm doing. Okay. Just want to check the hiatal hernia guy, because that's the main symptom, right? Hi.
It's 20% left, but it's good.
Okay. The little old lady's coming.
It's the same.
Little old lady's not doing a good job today.
Oh, it's better. It is.
No, I believe you. All right. Are you comfortable? All right. If you need to move, just move. You can move with the needles. Okay? All right. You have pain where at this point? What's going on?
Here.
How's now?
No, it's still there.
No change.
That's better.
Stomach 18, left side reflects cardiac, so we may have moved something too much for cardiac, and then that's, plus she really, we kind of left her here a little bit too long. So, okay, let's do the back.
How long do you normally leave the needles in?
15, 20 minutes. But, when you teach, it's impossible to, because it's like, explanations, this, that, and the other. Because from the time we started, look, we started her 2 hours ago at least. Oh, thank you. Oh, there may be even more than that somewhere. I have no idea. I can't guarantee. Let's take all the ashes away from you. Okay. So let's turn you over. One of the things that I have to check on her is T11, T12 that we call sugar points. And you will find lots. You can just automatically needle T11, T12 on absolutely anyone for two reasons. Number one, we say sugar points and lots of people have sugar issues because we're so pasta-oriented, carbs-oriented. But the other thing is, when you're looking at your downward motion, okay, what's going to happen with most people, it doesn't matter whether they're like this or they're like this. Their ribs, people don't like supporting their own ribs. It's just not comfortable. It's so much easier to just let the ribs sink down. So where's the bottom of the ribs? T11, T12 is basically going to be like this. It's a high exaggeration. Most people don't stand, half a mile behind themselves. But that's, so you can see it. Basically, people are like, so we need to lift them up. Okay? Now, she had autonomic nervous system also. By the way, okay. So can everybody stand for a moment? And what I want you to do is stick your tailbone back and then tuck it under and play with it. Okay? And keep it sticking back out and see what it feels like. And then tuck it under and see what it feels like. And then let the tailbone separate your sit bones away from each other and let your tailbone just drop down. And tell me what you feel with those three different things. Tailbone back, tailbone forward, tailbone straight down, as much as you might be able to.
Back's like a kind of a bit more wide, like you're going to
pounce something. Yes, yeah, I would agree.
This is a bit more stone and lethargic.
Yeah.
And then down naturally feels quite calm.
I would tend to agree. Anybody will disagree with him? Anybody not feeling anything? Because if you're not feeling anything, the other metaphor is, think of a dog. They wag their tail and they're happy. But it's actually not true. So you can sit down. So tailbone basically relates to the nervous system. So I'm going to check. There's a good chance that she has 1, 2, 3. Oops. 2 or 3 or both?
Both.
Both. 2 and 3.
3 mainly.
Okay. When I poke tailbone, how is 2? How is 3?
You still feel them, but the pain isn't. So I guess it's 60% better.
Okay, let me change location. How's 2 and 3?
Yeah, about the same.
That's better? Okay. So I do 2 on lots of people. Okay, it's like one of those things that, plus, Papa, low thyroid, right? Do 2. If you have low thyroid, we say thyroid belongs in the kidney. But even TCM, how are you going to describe low thyroid in Chinese terminology? Without using organs.
Yang deficiency.
Yes. That's much better. No, for what I want to do. So if I activate the do means to counteract hypothyroid. Papa had, no. So our treatments for hypothyroid on the back, on the front we do kidney. On the back we do, which had nothing to do, not in her case. On the back we do 2, T11, T12, T7, T5. Okay? That's our treatment for hypothyroid. Now I'm going to do T11, T12, sorry. Do 2, T11, 12, T7 and T5. If you talk to Kiiko nowadays, she'll tell you T9 and T4 rather than T7 and T5. I'm old-fashioned. I do T7, T5. Okay? And you can add to it L2, by the way, if you want. Hypothyroid, not hyper, only hypo. Okay? So, anything here? No? But I feel a little bit gummy. Okay, so.
What are you testing against with those?
So the reason why I test autonomic nervous system against UB42, 43, 44 on the left side, that's, by the way, that's not a Kiikoism. Okay, why? Because autonomic nervous system, one of the bundles of the nervous system, the bigger bundles of the nervous system, autonomic nervous system, is the pacemaker. So now in her case, you can think, oh, it has because of Papa cardiac. No, I'm testing. It's on everyone. I'm testing it that way. Okay, so. Bladder 42, 43, 44. You know, any of those. Hi, how's 2 and 3 now?
They're better.
How much is left?
About 10%.
10%. Okay. Let's see what happens if I do sugar points. Hi, how's 3?
It's gone.
And how's 2?
It's gone.
Okay. Now, sugar points, I generally do the Wattos. Kiiko likes to do the do, possibly more than the Wattos, generally speaking. I do the Wattos and I do them up because I'm trying to move it up. Okay? And I can do also slightly in towards the spine. So in this case, I've done more up than towards the spine. Now, I'll do the T7 and the T5, but actually because if it's celiac, it could also relate in some way to the pancreas. And you know, pancreas shu is T8. You know, extra, you know, because on T8 level, there's no shu points, right? There's only diaphragm shu and then liver shu. But in between, you know, extra point, they say pancreas shu. Okay, so but in my experience, pancreas reflects actually anywhere between T6 and T9. Okay, so I'm basically just going to look for, I think here. Oh, painful. Okay. Let me try and release it before. Pain, right?
Yeah.
Okay. When I press 16, how is pain?
It's gone.
Gone. Okay. Okay, so this do 16 business, it's, first of all, must be good friend of do 2. Opposite ends, right? Kiiko loves do 16. for almost anything, especially autoimmune. So you'll notice that these ones on top, I'm doing more 45 degrees towards the spine. I'm not that interested in moving them upwards.
Avi, what's the button you need now?
I would call it T6 or T7 or something. But I'm rather than going for the thyroid, I'm looking at it more as pancreas and T5. So actually, you know, we'll call it T7 and T5 because if I call this 6, then this has to be 3 or 4. So I just changed my namings.
Do you have a difference between do 16 and do 15?
Not really. In fact, the spiel started with do 15.
Yeah.
And then it changed, you know, like 2 months later, you know, Kiiko was calling it do 16 and nobody asked why. And I'm like, that's kind of weird. But, you know, so no, I don't think it's a huge
Just
issue.
The big hole.
Yeah. Now, quite honestly, I personally, rather than go for do 16 because I like the side, I'll actually go to the mastoid bone and needle upwards that way over do 16 personally. If you tell Kiiko, she'll kill you, and because then she'll kill me too. But that's my preference of creating this. You know, yes, if you... Okay, can I have someone here? Actually, Eileen, you would be a good person for this. Oh, no, it was actually for something totally different reason. So, if I do this to you, no, don't respond too yeah. Well, not move. Okay, tell me what this feels like versus what this feels like.
Okay, well, the latter one is a lift of the
Yes.
occiput, and the other feels like I'm being pushed forwards.
Okay, so that's cool. And now let's talk about the rest of you. What you feel in the rest of the body between do 16 and the occiput.
The latter, with the occiput going up, there's a little stretch right through the spine.
Yeah.
But
Where
the forwards doesn't achieve
yeah.
that.
Whereas supposedly do 16 should do it.
Yeah.
You know, theoretically, we're thinking do 16 is on the spine. It should lengthen the spine more. But actually, it's if you get the occiput, you actually get a better, you know, coming from the sides gets you a better grip if you want. Thank you. So I generally will tend to go for the sides rather than for the center. Okay, but whether it's do 15 or 16 or how far up you are on the occiput, blah, 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 no, not a huge deal. Make sense?
But you needle do 16
I needle do 16 in her
here
case.
because
It was easier to not go through the spiel, which I went through anyway afterwards.
sorry.
It's one of those things, you know, it was like, it seemed like it would be a quick way of doing it. And then it ended up not being so quick. So, any other questions?
Can I ask about the direction you use?
Yeah, the direction is, okay, if you're doing do 16, you're going to go kind of towards yin tang, so up and forward. If you're going under the occiput, I would do a little less of a little less this way and a little bit more like parallel to the skin upwards.
And if you're going under the occiput, how far out are you? As far as...
It kind of doesn't matter, anywhere along. In fact, if I were to do it on her, I would tend to try and go towards the mastoid. Why? Because the mastoid and autoimmune disorders are related. Now, we haven't fully established her as an autoimmune. Right. Now, and since she's officially slow pulse, even though that was not the pulse I felt, the equivalent of REN4 on the back is UB27. Okay, or UB26. REN4 is called Gao Wang. UB26 is called Gao Wang Shu. Okay, so if I'm inspiring anything in you, it should be go back and look at these damn point names, which I know you've all wanted to ignore your whole life because the numbers were way more than enough. But unfortunately, if you want to relate to where this all came from, it didn't come from numbers. It came from, people named things. And that will give you some insight as to, and of course, our insight is not going to be theirs. So, now, okay. Well, I'm sorry.
And this is on the outside of the sacrum.
So sacrum business. Come over. This is our sacrum. It can't be any larger than that. I don't care how big her breasts are, how big her hips are, or how big anything is. No one has a sacrum that comes all the way up to here. I mean, it's impossible. Okay, if the sacrum is a bunch of fused vertebrae, and the vertebrae here are, say, come out to here with the transverse processes or whatever these things are called, there is no way that down here it's going to extend to here. But if you come out, yes, you feel the end of the sacrum here, and then there's the iliac bone. This is outside the iliac bone. But if you just slide, that's where you're going to land. So it's just so much easier than for me to try and get a needle in between here, in the narrower part. Now, the Liao points, they're inside of this. Okay? So I tend to take it all the way out because it's just easier. Now, people with autoimmune disorders will have a big gummy thing here. It's like a ping pong ball. Okay, and she doesn't have so much. She just has a slight. It's not really ping pong, but she definitely reacts. Boom, right? Okay, so because any pain on UB60. Okay, when I push on UB60, how's ping pong?
It's gone.
It's gone. Okay. Now, wait, let me see if the right side will respond the same way. It's not as bad here, right?
No.
Okay. Because I think autoimmune or autoimmune style plus cardiac left side is going to show more. Let me just see anywhere on the right.
Yeah.
Okay, but not as severe.
No.
Okay. Any pain on 60? No. It's a fire point. That's why I have to check if it's painful. Okay. When I press 60 upwards, how's little ping pong?
Gone.
Okay. Any cardiac presentation, we check UB60. Okay, this is going to sound just like your TCM. The fire of the heart goes to the small intestine, fire goes through the Taiyang to the bladder. Okay, it's the exact same ideology. We check UB60. If UB60 is painful, we do 66 and 67, which is metal water. If not, we can needle it. And then I can needle the sacroiliac ligaments. I just don't want to needle them while they're uncomfortable. Usually we just do the 61 side, but in her case I'll do both. And it's usually the left side for cardiac.
So I'm a bit confused there. I thought you said if blood 60 was
painful,
you do 66 and 67.
Yeah, because it's bladder 60 is fire point. If fire point is painful, I do metal water. Her UB60 is not painful.
Right.
I can do it.
Right, sorry.
Originally, the idea was we were needling UB60.
Right.
Then we said, oh, wait, UB60 is fire point. If it's painful, we should do 66, 67.
It's not painful.
Okay. Ping pong okay? Or better?
It's 95%.
95% gone is fine, I can needle. So when I say don't needle a painful point does not mean never needle a painful point. It means you can release it first, then you may needle it. Which reminds me, are you comfortable?
I am, yes.
Thank you. That, how's you shivering?
It's almost gone.
Good. I'm away, she's stopped shivering. But she had, how's kidney 2?
Still sensitive, but less than before.
Less than before, okay. And how's spleen 2?
That's cool.
Okay. Okay. So that's another kind of a very interesting phenomenon. You can actually get rid of fire points not with just metal water. There's a whole bunch of other things you can do. In other words, if it's just one indication, so if I should have done supposedly kidney 7 on this side, but it wasn't the most successful. Okay, so, but you know, it's like if you have pain on a place, you want to release it before you're going to needle it. If you're going to needle, not that I was going to needle 5 points, but just reminded me that we had that. Okay, questions?
I was just wondering, when previously you said that because...
She broke her collarbone.
So
If she broke her collarbone, I don't know, but I kind of figured once she started shivering and stuff, I'm looking at how can I be the most minimalistic I can to not over push. Can I let go of having to finish adrenal treatment? She has the lower kidney point. She doesn't get that. Plus, because I don't know what I'm going to find here. Because I could have checked it a little bit better and go for it or not go for it. I decided in advance not to.
just because she was shivering?
Because she was shivering, no, but the first thing is...
Sorry, I was shivering.
No, it's okay. No, because she broke her... No, I would have done it if she was shivering. That wouldn't have been the point. But since I know I have to check, and then I'm risking a whole phenomenon. Oh, my collarbone is painful. I have to fix the collarbone first. I mean, I didn't want to get into like too big an involvement in a situation where I want to keep moving it forward. Does that make sense?
Even though this collarbone may have been broken 20 years.
Doesn't matter. First of all, collarbone never get. There are a few bones in the body that, no matter what, are never fixed. Collarbone is one of them. It just once you break the clavicle, it's never 100% the same. It can't be. So so you're going to find something there, in all likelihood. What's the others? I knew somebody would ask me, and I was starting to think because I know there's others. As soon as I configure them in my brain, I will let you know, because I know there's at least 2 others, and it's just ain't coming up. Sorry?
Tailbone.
I'm not so sure that tailbone's one of them. It might be.
Side bone. Right.
Let me see if I figure some of it out. But it's just that because I palpate kidney 27, I can tell you that there's always some puffiness here. That's the big deal for me. The other ones are a little bit more theoretical. They're not as clear, or they're not clear to me right now. So how's that for an answer? Sorry. Yeah.
There was still pressure pain on her left. Did you do that? I couldn't see whether you did bladder 60 on the left.
I did bladder 60 on the left. No, there was no pressure pain. No, there was no pressure pain in bladder 60. I did bladder 60 both sides because I'm trying to fix. Okay, I'm trying to fix UB27 both sides, especially on the left. Okay, since UB27 is important to me because, number one, possible slow pulse, supposedly, with possibility of cardiac, possibility of autoimmune. Since UB27 was ping-pong painful on the left, I went to how can I release it before I needle it? UB60 or 67 if I need to. Then I did it on the right as well because it's not just cardiac, it's autoimmune. And even though right side UB27 was not as severe, I thought, okay, let me release it anyway, take insurance on it. That's all. Okay. Other questions? Yeah.
If bladder 60 was sore and you did 66, 67,
Yeah.
would you then...
Each side could be different, by the way.
Would you test the sacroiliac joint?
Of course.
And if it
That was really my target.
If it was still sore, would you then needle bladder 60?
No.
Okay.
No, I think that's a little bit... first of all, metal, water plus fire doesn't make sense. Either do if metal water doesn't help, but UB60 does help, then, okay, you know what? Your fire point is painful, but the dogma to release it doesn't really help the patient. It only helps my dogma.
Okay.
What's the point of needling something just because the idea is there? The idea has to show in the body.
Yeah.
So remember, you're prioritizing and you're testing your priorities constantly. If the test doesn't show it, don't do it. You're wasting your time just doing the
I
theory.
suppose the primary thing though was the sacroiliac joint. And I was just
For-
thinking that would you test 66, 67, see if that actually released that? Because you were doing
No, because she didn't have bladder 60 pain and bladder 60. Okay, we're going to get very convoluted here. Since in her case there was no UB60 pain and UB60 released it, I'm good. If she had pain, and then you said, I would do 66, 67, and hopefully it releases the sacroiliac, fabulous. If 66, 67 does not release the sacroiliac, I'm not interested in it, just because I want to do firepoint ideology. Now, if 60 was painful, but releases sacroiliac, and 66, 67 does not, I don't have a lot of choice. It's going to be 60. It's not the end of the world needling a point that's not, I mean, if she was screaming on UB60, okay, I won't do it. But remember, I started with, she didn't like this. Now she doesn't like this. So I'm going to do 60. I mean, how many recursive situations are you going to get into? And then, all in order to fix this one, and when this recursion really doesn't fix this to begin with, where am I going to go now? So if 60 was painful, but 66, 67 would not have fixed, UB27, but 60 did, then never mind that 60 is painful. It's not the end of the world. By the way, you're making these decisions, and then the patient comes back the next week and reports, it's this much better, it's not better, and then you readjust. And you go, you know what, maybe the UB60 was a mistake. Maybe it should be 66, 67. It's okay not to have the absolute perfect combination the first treatment. You can't. In fact, you shouldn't. Because it's the feedback they give you. When people ask you to prognosis or something, I don't give them. Next week, I want to see how it affects you. How can I tell you how it's going to be? You're going to tell me how it was. According to that, I can say, okay, seems like you're easy going, you're getting better. Oh, I can give you a prognosis. Yeah, 4 more treatments, whatever. But if you come back the next week, you say, wow, that sucked. Then I say, oh, well, you're much more difficult. The first treatment, all you know is if the body's changing on the table. Some people, you can change the abdomen like this. You can't touch the symptoms. Some people, you can't change the abdomen, but the symptom goes away. How do you know how this person's going to be? You don't want to work just with theory. Make sense?
Yeah.
Okay. All right. Let's turn you over. Are you okay?
Mm-hmm.
All right.
Would you consider like shaking sort of like that be an indication of
Sorry?
autonomic nervous system?
Would I
Shaking.
could?
Like is that sort of
There could be. There could be an autonomic nervous system component, especially because of the sweating. That was the first thing that... Okay. Who touched the knees before? Come touch again. It's not perfect, but it's a lot less different. Now, I want to explain something. All these labels that I have, autonomic nervous system, blah, 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 they're changeable. They're not as important. I mean, they're just there for me to choose points. So she can be autonomic nervous system, but I can treat even the autonomic nervous system through inner yin liver 9. Do you see what I'm saying? Or kidney 8. Or, it's whatever treats it. Just because we have an ideology, autonomic nervous system, and we have a protocol for it, doesn't mean that you can't use something totally different. The protocols, the points for using it, they're just in the service of moving something in the body. And if you can do it in different way, that's just as good. So we don't have a single protocol with kidney 8 in it. It's like it's a point that doesn't exist in our vocabulary. But in her case, it went, something different clicked. Okay? I just want to check the hernia for a second.
It's better.
Okay. Smiling is the best. It's kind of like, how are your eyes?
Good.
Good. Okay. Can we turn you over? And are you still okay?
Yeah,
Okay, because I know we're keeping you forever here.
very nice.
I've got a patient who's recently had lower leg amputated.
Uh-huh.
What would you do in that regard?
Is that the complaint?
Well, she's got everything.
What's the everything?
Well, she originally came with fibromyalgia, and now she's got severe. She's got a lot of stuff.
Hold the question.
My general question would be,
Yeah.
if you haven't got the leg there, how can you treat the?
You've got the leg there. I'll show you.
Yeah.
There's always a leg there. Do you have diodrings?
Yes.
You've got a leg. I'll explain to you. Hold on. Besides, there's always something else. It's not a problem. Whatever there is, there's something else. Okay. Are the arms comfortable here, or would you prefer them here? And you can move them halfway between. You can put them under the pillow too. You can do whatever you want. I'm just letting you know that you have options. That's all. Okay. So of course I do 2 on everyone, but let's just see what else. I have to be careful. Oh, yeah. So if someone wants to touch here, is that okay?
Yeah.
Very soft on her. It's almost like the bones are soft. It's not because she's big, and not, wow, lots of fat. It's something, even when you get down to the bone, it feels a little bit mushy bone. Not mushy bone. So, no, which makes sense because you say, I don't know, maybe that's, wait, maybe they have mineral issues because you said Slovenia, Austria, blah, blah, blah,
Possible, yeah.
Are they drinking water from the Danube or something? Don't know where I come up with this stuff. I'm just making stuff up. No, I mean, there could be regions in the world.
Yes. Mainly because we are a karst nation, so the water is karstic. It's
Caustic soda.
What does that mean?
caves where you have caves.
Oh,
If the stone is, yeah, yeah, it's limestone who does, so we don't have a lot of calcium.
Don't have a lot of calcium in the water.
Yeah.
so maybe that's why their hips are weaker. Okay, well, hold on. Okay, so officially, let's do back diagnosis officially. You go 1, 2, 3, 4. Oh, you have everything here again. Fabulous, no problem. Okay, we're not going to do official back diagnosis because nobody's going to remember. Okay, so we can look at do 2 or. Okay, 1, 2, 3, 4. 2, 2, 3, 4. Everything up to now, right?
Yeah.
3, 2, 3, 4. Everything. 4, 2, 3, 4.
The other 2 was really bad, but everything, yeah.
The 2 sequence or the the last 2?
The 2, when you said 2, yeah, where you're.
Meaning 4, 2.
Yeah.
This one. Okay.
Yeah.
2, this one. Ming Man. Okay, fine. Right side. 1, 2, 3, 4. 2, 2, 3, 4. Seems less easier, the right side, isn't it?
It is easier.
Okay. 4, 3, 2, 3, 4. 4, 2, 3, 4. 5, 2, 3.
It's easier, but still present. But
Okay.
It's easier.
What about this area here?
Yeah, it is painful.
This one. Okay. This one and this one. Ming Man.
So you palpated all the way down the Huato areas?
Yes.
All the way down?
I don't bother with the do personally. I should, but I don't.
Okay.
I should, but this is if you really want to do systematically, check everything. But since she has everything, there was no point in recording it. Normally you'll find 3 or 4 on each side, and then you can mark or whatever. Okay.
Were you reading telephone numbers, or was it something to do with the vertebrae?
I was just giving her numbers. Tell me where it's painful. I wasn't. No. You can relax. I'm sorry. I overdid.
The left side of the back is more painful.
She doesn't have a hernia, she has a lordotic curve.
Oh, I mean, sorry. With the,
Which again could, this hernia, I'm sorry. Then I'm sorry, start again?
well, it's on the left side.
Yeah, so maybe, I don't know. I didn't even think of it. She's starting to shiver again. Okay.
No, I'm fine.
You fine? Okay. So, pressing heart 3. Big one was here, right? Okay. I mean, because I don't want to check everything because it takes time, right? How's Mingmen? Big one.
Still present.
No change.
No.
Okay, I'm just checking mineral option.
It's 5% better.
Only 5%. To hell with 5%. Okay, forget the minerals. I don't care about the caustic water and whatever it is.
That's a specific mineral test you just did.
Okay, we have points. We have 1, 2, 3, 4, 5 points that have the character ocean in them. Hai. Okay, kidney 6. We talked about Jiao Hai. Spleen 10. Shui Hai, ocean of blood. Qi Hai, Ren 6. Xiao Hai and Xiao Hai, small and smaller oceans. Okay, ocean means it has minerals in it. If I'm thinking maybe I need to do mineral treatment on her, but I think I'll go back to genetic treatment. Okay, let's go back to genetics. Okay, Mingmen, right? Okay. 53. Sorry. How's Mingmen?
Gone.
Gone. Okay. 1, 2, 3, 4.
Yeah, this one's painful. But less than before.
Okay. I know it's hard to tell, but just give me a rough estimation.
It's 20% left.
20% left. Okay. 2, 2, 3, 4.
So the 2 2s were the same. The 3 4 were
Better. Okay. 3, 2, 3, 4.
3. The first 3 was present, the same. The others are gone.
Okay. 4, 2 I know is better. 3, 4. Where are we at?
The 4 was still painful. The 2 was gone, and the others were gone actually.
Okay.
And what were you pressing to reduce that?
UB53. I'm back to the Huang. Okay. Remember, I think her story has to do with the missing organ, the genetics, not the missing calcium. So missing organ we have on the back. We have 3 points: outside Sanjiao Shu, UB53, and UB43. Really, main one should be 43. But hold on. Let's see what we can do.
Do you locate 53 again? Just
Okay. Do you remember the use? Okay. Go from the center, go outside the sacroiliac ligaments. That's UB53. Level with UB32, which is hard to tell where her UB32 is because this is the formation here is not so clear, unfortunately. So it may be a little lower, a little higher. It did the job. Then we'll. Okay. Going one. Tell me when there's something that's more significant than the others. Okay. So 1, 2, 3, 4. 4. 1, 2, 3, 4.
1.
Okay, so 4 and 1. 3, 2, 3, 4.
First 2.
Okay, 1 and 2. Okay, and 1, 2, 3, 4, 5.
2 and 5.
2 and 5. Okay, so especially 5. Okay, so 1, 2, 3. Okay, 4, 5, 6, 7. Especially 7. Okay, UB43. How's 7?
Same.
Hold on. Now,
It's 10% better, but
only 10%. Hold on. Now, this may have to do with the lordosis only. So, okay, how's 5?
it's gone.
Okay, how is, if that was 6 maybe. Okay, how is this one and this one? I don't remember the numbers.
Gone.
Gone, great. And how is this one, and this one?
The middle one is still.
The middle one's still there, but the other one, okay, fine. So 43. Because I was wrong to take the strongest one because that has to do with the way her L5 because of the lordosis. Okay, so middle one's still here, and this one's still here, right? Okay, we'll take care of it. On this side, 1, 2, 3, 4, anything? 1, 2, 3, 4. 1, 2, 3, 4.
1 and 4, but
1 and 4, okay. 1, 2, 3, 4.
yeah, 4 definitely.
4 definitely. 1, 2. 2 especially. Okay. So 1, 2, 3, 4, 5. Correct? Okay. UB43. Sorry, UB43. How is 1?
Gone.
2.
5% left. So it's
Okay, not counted. 3, 4, 5.
4 and 5 still present, but that was gone.
Okay. So basically we're back to basically the lordotic part, which maybe have to do with genetics, some weakness, but that's what I have left. Okay. Next. I can try other things that have to do with ancestors, like small intestine 11, if I wanted to, but I don't think they'll relate as well to the L5, so let me, just one second. Let me see if I can get it from GB39, has to do with marrow. Hi. You have here, here, and here, correct? All right. How's the third one?
Gone.
How's the one before?
Still 20%.
20. And how's the opposite side?
Gone.
Okay, so I still have 20% here. Hold on. And now?
Gone.
Okay, just moving the point. Sorry?
So yeah, you were going to say.
I just moved the point a little bit, that's all. So gallbladder 39, because it's related to marrow, her lordosis, if I can fill the spine, if I can give her more stability, more strength, sturdiness, and lots of strength, marrow.
Do you needle this one vertically?
I needle it, see the angle? Can you see?
Because I think
Against the channel.
I thought you said it was one of the
Against the channel is upwards.
one of the 2 points you needle.
UB60 on her, by the way, upwards, it's against the channel. GB39 upwards, that's against the channel.
All right.
So yes, vertically.
No, I thought you said it was there were 2 points you said that you needle. You often needle straight, straight in, perpendicularly.
Only one that I recall needling that I'm aware that I use is mushu.
All right, I must have misunderstood.
Yeah, I don't. Everything else I do. Those two are against. These are the two that I needle against the channel.
Oh, yeah, against the channel.
Yeah. All right. Are you comfortable? Officially, 43 should be moxa. Okay. Yes.
Now, I should ask, with her hip and everything, is it the right hip that was worse than her back? In terms of the structure and thinking if there might be something affecting that crossways,
They certainly could be.
would you have maybe had more time or something, gone into inguinal ligament or checking the back of the right hip and addressing that?
She had, and we fixed with kidney A. I mean, we did manage to get rid of the inguinal.
Release, okay.
But if I recall correctly, the thing that helped the hernia most was this. See, sometimes it's very weird. Sometimes you have to, in acupuncture, have a lot of detail and do a lot of analysis. And sometimes you have to be like this total space cadet that goes, well, energetically it does it. And you have to be able to operate on both levels. This is a case for right now where we're going, this is the energetics. I'm taking the idea of the energetics and going, I'm trying to address that energetics and let's see what happens. Does that make sense? Okay. Now, did you say there is something left here or here? This one, not the right one. Okay. Sorry. Relax. Relax, Max. So not do 16. That's one option. Okay. No. Why not? Hi. How is down here?
Still present, but less.
Okay, fine. Going above to 17, but probably more to gallbladder. Okay, let me try gallbladder. How's now?
Gone.
Gone. This one is called empty brain. Okay. Okay, hold on. Let me. Can you get me a needle inside the guide tube? Because I'm trying to keep the point. Thank you so much.
That was checked against the.
Hmm?
What were you checking that against? Just the lordosis?
Okay, yeah. If I'm looking at lordosis and I'm looking, okay, she has okay, marrow and ancestors and genetics are a little bit related. Okay, if you have strong marrow and you have strong genetic, I mean, you know, I'm trying to give her more sturdiness in life. Okay, so marrow, the culmination of the marrow will be in the brain, right? So GB19, gallbladder 19, I believe it is called empty brain. But more importantly, when they talk about the sea of marrow, that phrase that in Lingshu 33, they say, they give, everywhere they give points, you know. So the sea of Chung is, you know, the small intestine, large intestine, lower hair points, blah, blah. In the marrow points, they say do 16. They name the point. You can't argue. But then they say at the cap at the top of the head. So some people say that means do 20. Do 20 has a name, and its name is not the cap of the top of the head. So the interpretation, in my opinion, is not correct. Okay? If the author wanted to say do 20, he would have said by way. He didn't. He said at the cap. So meaning you have a cap, like a yarmulke or something. And at the edge of it, now the question is, how big is this cap? Is it this size? Is it this? We don't know. And I think he left it that way on purpose because what he's saying, I think, he's saying the skull. Okay, so you're looking at, so for example, if you're on the front, I'll often use stomach 8 or somewhere around stomach 8 for things that I think are marrow. And if you're on the back, I'll possibly take stomach 8 and move it backwards, which will be here, or I'll take just above the occiput. Okay, so I'm thinking strengthening marrow for her. Okay, so strengthen the marrow, strengthen the genetics is what I think will give her a better sense of core. Make sense? Now, just 1 second. Just to give you an example out of this idea of, you know, like do 16 and whatever the cap is. I once went to a class, just to show you, you can make up anything you want. And no. The thing is does it work? So I went, very famous person, some Vietnamese person. He expert on classics, blah, 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 except when my friend showed him, we went to him with a text in Chinese, he ran away from us because the Vietnamese don't speak Chinese. They read it they take the text now and it's written in Vietnamese, but it's written in French. You know, the way the Vietnamese write nowadays is not characters. So anyway, he said that the large intestine 16 is part of the sea of marrow. And I was like, really? Where did you get that from? Eventually it went out, he claims that it's in the Lingshu. It's supposed to be Lingshu 33. And I'm like, don't think so. You know, I mean, it's very easy nowadays to do these things because you have PDFs of all these things. You just have to scan. It's not like I'm a genius and I know the whole Lingshu by heart. You know, it's just like you type it in and you go, does it exist? Oh, no, it doesn't. Forget it. Anyway, so I was like, God, the guy's like such an, you know, like he doesn't know anything. Blah, 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 blah. You know, I'm going off on my stuff and, you know. But then I was thinking, okay, you know, why does he say large intestine 16? I mean, there's got to be a reason. You know, where did this come from? And what I discussed, then I went, okay, the name of the point is called Jiugu, huge bone is the name of the point. How do you get a huge bone? You fill it up with marrow, right? And then it gets to be gigantic. Okay, so I started testing to see, does large intestine 16 help with marrow problems? And sometimes it does, especially low back issues. It's not a great point for low back. It's good as a supporting point. Okay, so by the way, for those of you who are interested in books and stuff, if you get Kiiko's 2 books, clinical studies or whatever it's called, one of the things you'll notice is, or what I notice is people call me and say, Avi, blah, blah, this point in the book it says, I'm like, what? Then I look at the book and I go, oh yes, it does say that. There is not enough differentiation for my taste. It's not a criticism, it's just when you look at the book, be very, trying to pay attention to see if you can figure out what are the main points and what are supporting points, okay? So for example, in cardiac situation, liver 1 can be a supporting point, but it's not the main thing for cardiac. The main thing for cardiac will be Rend 4. Why liver 1 supports? A few reasons. One is liver is mother of heart by 5 elements. Okay? Therefore, treating liver can treat heart, but also liver 1 is the point we use for autonomic nervous system with rapid pulse especially. Okay? So, and I think you have UB60 still. All right, I think you are needle free, and if you do 2, yes. Do none now. Sorry. Yeah, you do forget needles and people, and it's just the nature of it. How are you feeling? 3 hours later, how are you feeling? You fine? Are you sure?
Yes.
Yeah?
Thank you.
All right, thank you so much for coming.